When I was on rounds with Dr. Conti, he gave me a full lecture on the proper placement of my stethoscope.
My first name is Dean, so I had a name tag that said Dean Chapman, and when I showed up for orientation, all the other medical students would say, "Wow, the administration is really interested," and I say, "They've sent a dean to the orientation process," and then I kept coming back to the whole orientation process, and then I started showing up in the classes, and I think everybody, well, even BJ, eventually got the idea that I was actually a student there.
I was delivering a baby on the obstetric service, and the attending on call was Dr. Harry Prostowski. We're in the middle of the delivery, and the membranes had ruptured. That she's having these contractions and so forth, and so he's standing behind me. We're all gowned up, and I'm sitting on a stool. He's standing behind me, and he says, "Dr. McCullough, rupture the membrane." And I did, but the problem was it was the height of a contraction. So the next thing I see is this wall of amniotic fluid coming toward me, and I ducked to the side. He got from head to toe. One of the professors in pharmacology did a lot of research and developed the drug Diamox. He gave repeated lectures on the effect of Diamox on seagulls' nasal glands. We made a song up like the Mickey Mouse Club that said Diamox acetazolamide, which were the brand name and the generic name for the drug, to the tune of the Mickey Mouse Club.
The way people like Dr. Anna King taught was good, because instead of going in there and taking over and doing things that all you're doing is assisting him, when he was coming in to help you, it was a teaching experience.
I thought the training that we got at the university was excellent. I never had any problems with going on to the next step, and I give a lot of credit to the professors. They really took the time to have the students be well educated.
I remember some of their quotes, like Dr. Reisner, and I still use that, as Aunt Minnie. He described, when you're reading the x-ray, he said, "You might not see this. You may see this once every 2 or 3 years, but when you see it, you'll remember it. It's just like Aunt Minnie. You only see her every couple of years, but when you see her, you know who it is." And I said, wow, that's a great way to remember. I use that with the residents now.
I did a lot of research. That was one of my papers here. I wrote a paper and published it. Yeah. It has I had absolutely no idea. Comparative studies of sulfonamide acetylation, an inhibitor in dog liver. Listen, they got me through college, medical school.
The attacks of September 11th happened when we were in medical school, and it was a very difficult time. We also had patients we had to take care of, and was a lesson, a very difficult lesson. Although we were all grieving for what our country and what was going through at the time, we still had to take care of our patients who were ill in the hospital and had to put on our professional face.
Heart surgery. It had been around a while, but it was in rapid evolution. I scrubbed on the first two Weinberg, V-I-N-E-B-E-R-G, cardiac revascularization procedures done at that hospital with Dr. Myron Wheat. And, I thought that was neat. Here I am, I'm a third-year medical student, and I'm scrubbing on a thing that's never been done in this hospital and probably never been done in Florida.
I think that's when we first became aware of the AIDS crisis, and that really impacted how a lot of folks decided to choose their careers and how we practice medicine today.
An interesting procedure that was developed while I was at the University of Florida as a student and later as a urology resident was what's called extracorporeal shockwave lithotripsy, which is a non-invasive treatment of kidney stones. And that really changed the face of urology. Many urology patients required open kidney stone surgery prior to this. And this was really the beginning of the revolution in minimally invasive urology.
And people talk about Watergate like it was this big thing, and I feel like, I missed that. And I think it was just because I was busy and I was studying, and I didn't even have a television.
Like, I don't know what I would do without the internet, you know, in terms of my education. It makes a huge difference because when you're on your rotations, like, you're not in a library, you don't have, you know, lots of reference books around you, but you can hop on the internet and go to Up to Date or our online library and look up anything that you need to right then and there.
Practicing medicine, gosh, it means a lot. For me, it means establishing relationships and having an extended family to care for.
Well, I actually joke about that term sometimes. They'll say, well, you know, how's that progressing for you? It's getting better, it's getting better. And I say, you know, they call it practicing medicine.
It's really fulfilling. I really enjoy my job. I really like seeing my patients. I like helping them. I like feeling like I'm making progress and making an impact in their life.
And I think a lot of folks will go into medicine as a little bit of a calling too, because you really, any profession, you put some of yourself into it if you want to be good because you care.
Go Gators encompasses everything of the Gator Nation. It makes me smile every time that I say it, that I have a lot of pride that went to the University of Florida.
Oh, go Gators, that's so important. And I was always proud to be a Gator.
It's just such a special thing to have been a part of. I knew it then, and I know it now. And I just say, wow, talk about being lucky to be able to be a part of that. And I just look upon it as sort of like the mountaintop experience of my life.
I wouldn't trade. I've always been proud of my education. Wherever I went, I felt like I could hold my own with anyone.
Go Gators to me means you're a great institution. You're doing so much good. Just keep doing that and put everything on the line for it.